All right, great. Thank you, everyone, and thanks for inviting me to be part of the panel. I'm going to give a sort of an academic flavor to this and talk a little bit about the Center for Effective Global Action, some of the work that we do in this sector, and really focus on the expansion of data that's available to reveal humanitarian challenges and also drive some of the solutions. CEGA is a network of West Coast researchers. It's a mix of economists, technologists, all working to identify the causal impacts of interventions, programs, and policies, but also the impacts of economic shocks, natural disasters, other shocks to vulnerable communities, with the aim of identifying where resources should be targeted, how they should be targeted, what problems most urgently need to be addressed. So the good news is, in the last 10 to 15 years, there are scores more economists and social scientists who are in the field collecting data in developing countries, generating rich sources of information. These include long-term longitudinal studies with data collected over many years. It includes experiments, randomized controlled trials. This, in a sense, has created a set of sentinel sites throughout vulnerable communities and throughout the developing world, places where we have existing baseline data being collected, where there are relationships for data collection, people who are trained to capture the voices of people who are very vulnerable. And I think this is one of the contributions that academia makes to this question of what are the humanitarian challenges that we need to be addressing. I wanted to give a couple of examples from researchers in our network here on the West Coast who, because they were already in the field collecting data, were able to make some important contributions to understanding humanitarian challenges. The first is from Pascaline Dupas at Stanford and Jonathan Robinson at UC Santa Cruz, who, in the wake of Kenya's post-2007 elections violence, were able to capture a lot of the impacts of the civil unrest because they were already running experiments in Western Kenya. They collected surveys from small market owners, from informal workers, including bicycle drivers and women who work in markets, also from sex workers, and I'll tell you more about that in a minute. What they found is not too surprising in the aftermath of that 2007 election and the ensuing violence. They saw increases of up to 15% in some goods, retail goods, 30 to 55% declines in incomes in that first 1 or 2 months after the violence, and a 60 to 90% drop in income in the first few weeks after the violence erupted. They saw associated drops in food consumption. One of the reasons this study is so interesting, though, is because it revealed one of the hidden costs of violence, which was the vulnerability of sex workers. So they saw a 100% increase in risky transactional sex amongst women in this study area in Western Kenya. This is an area with very high HIV prevalence, 10%, so well above Kenya's national average. So I guess what I'm trying to say is that these sentinel studies, though they're not part of a large initiative or program, they surface a lot of the hidden needs of vulnerable communities in the aftermath of a crisis. That's an example that's very short term. The researchers were on site. They were able to get into communities and survey hundreds of individuals in a very short period of time. But of course, short-term data isn't enough. A lot of the effects of crises persist for many years. So there's an example I wanted to give in Indonesia, where a group of researchers, including Manisha Shah at UCLA, studied households who had had varying levels of exposure to floods and earthquakes in Indonesia, a place that's plagued by natural disasters. And what they found, they played a series of behavioral games with people who had been exposed at different levels to different kinds of shocks, and tried to tease apart how does exposure to a shock change your risk tolerance. Are you less likely to gamble? Are you less likely to take chances that might improve your livelihoods? And they found, maybe not surprisingly, more than 50% less tolerance of risk in people who had experienced a serious economic shock in the last year or two. So this really sort of echoes the concept that Brian raised of this world of people who are very vulnerable. They don't take risks. There's a lot of fear. That impairs their economic development. That makes it very difficult if you're a farmer to invest in fertilizer that's going to increase your yield. It makes you less likely to invest in your children because you don't know if they'll survive. This revealed another hidden need, perhaps the need for insurance products as part of humanitarian response, giving people some reliable protection from future events. There is even some evidence coming out of Katrina that having property insurance reduced PTSD in people who survived that event, so that hurricane. So I think there are a number of ways in which ongoing data collection and experiments allow us to surface some of the needs that are maybe unexpected and not obvious. Of course, academics and their data collection also helps guide the development of innovations in humanitarian assistance. One of the interesting ones that I thought I'd talk about is a lot of innovation using satellite data and mobile call detail records to understand where there are pockets of poverty, where there are people who are most vulnerable to risks. There are a couple of projects that you may have heard of, one using call detail records from Rwanda, which was able to track the response of people after an earthquake in Rwanda. Other work that is actually very basic science, but it can be used in a very applied context to understand where people in need exist in the world and how to find them. I want to talk just in one last minute about our role in evaluating technologies for humanitarian assistance. This is something that researchers in the CEGA network have started to do. We often see that technologists are using user-based design to develop new technologies or interventions, and also trying to involve communities in that design. I wanted to give one last example of a study that reveals some of the challenges in developing technologies for humanitarian response. The example comes from Sierra Leone, and it was an effort by the government after the war to build democratic institutions very locally. So in communities, build up village development councils that could make decisions in a very equitable and transparent way about resource allocation, about where to invest funds that the government was going to give to communities. A couple of researchers, Catherine Casey at Stanford, Ted Miguel here at Berkeley, and Rachel Glenister at MIT, helped design a randomized experiment that would evaluate the impacts of this intervention. Very community-driven, very community-led decision about how to respond to Sierra Leone's post-conflict environment. The model was to intensely moderate and help facilitate community meetings so that people could collectively decide what they would invest a $5,000 cash grant in. This study went across 200 villages. The researchers found almost no impact of the intervention on building youth voices, women's participation. They weren't really able to see any impact on the way decisions were made in these communities within Sierra Leone. So it's a story of a study that tracked what was a promising intervention, found no results. It's in a sense, a failure. It's also a success because we learned something. We learned about the challenges in creating programs that are led by communities that are intended to be democratic, but often may not be. So I think there's a lot of work trying to evaluate interventions post-humanitarian crisis, and it's something that we're very interested in working on and hearing from all of you if there are opportunities. Thank you.